So that's what our 2,000 stories are. And they're all about connecting things that weren't connected. And they all have a person or a group, a person in case like the woman I was talking to, who began the connective process, created an association. And incidentally, they met every day in the local park building, because the park manager gave them a room to meet in the morning. So on this map, this is a story about a woman with a special gift of thinking she could do something for her daughter, who created an association of neighbors who acted in powerful ways in concert with a local institution called the park. Did you notice how many grants there were in the story? How much technical assistance there was? How many professionals were involved? So what I think our research helps lift up is the fact that what a citizen is somebody who has the capacity to envision a future and make it come true. A citizen is a producer of the future. That is in contrast to somebody who is not a citizen. That's somebody called a consumer. They're not a producer. Or somebody called a client. So the more consumers and the more clients we have, we are not increasing citizenship at all. We're training people to believe that they can't do it. They've got to buy it from somebody else. These women could have gone to the parks and said, will you develop a program for us? Couldn't they? And the parks would go to the city council and say, if you give us more money, we'll develop a program for girls. So there are two ways. And the citizen way is we produce the future, not buy it. Now the second thing about society is the heart of civic engagement. And civil society is the blue space. But does it look black to you back there? Not the red space. If you have any serious civic engagement, you have to understand every person as being gifted. And number two, you have to know what the associations are and to promote more of them. Now, that may sound like it's a limited idea. So what about the institution? Aren't they part of civil society? We know from two horrendous, horrible histories in the 20th century that they aren't part of civil society. Because Nazi Germany had some of the greatest institutions the world had ever known. Its medical system was better than ours by far when Hitler took over. Its technology was advanced beyond ours. The same is true of the Soviet Union. It had great institutions. So imagine a map in which the red space is strong, but the black space is stamped out. And the name of that is Nazi Germany, the Soviet Union, or totalitarianism. So what makes us a democracy is two things. Number one, we vote. And number two, we have the power to make the future through our gifts, talents, and abilities and our association. The third thing that I want to suggest about this space, and I'm thinking small here, this is not a city map, the neighborhood. The third thing is that if you look closely at the history of the last 50 years, what we've learned is the limits of what institutions can do for us, whether they are not-for-profit, for-profit, or government. And in the book that was described, we try to be very careful in saying, if limits are clear now about our institutions, but we still want things to be improved, where will we look to improve? And the answer is here, in the middle, in civil society. That the undone work of our future is now with us in our communities defined this way. And let me remind you what it is that are the neighborhood necessities. What is it that we cannot buy, that a professional cannot provide, that is our domain as citizens? So can you show me the next one? Here, I think, are the 7 neighborhood necessities. The 7 aspects of well-being, which, if we don't produce them in our relationships locally, no institution can substitute for what we don't do. It's us or it won't get done. We know that the medical system, we have a great struggle to try to get everybody covered by medical systems. But every epidemiologist will tell you that in terms of how long you'll live and how often you'll be sick, that medicine accounts statistically for about 10% of your health. The other 90% has to do with community factors, individual behavior, associational relationships, the physical environment. Those are the major determinants of health. So we hopefully will have everybody assured, and then we'll have done 10% of the job. And we can't get any more. You understand? Every institution has its limits. There's no person who really works in the medical system who doesn't know this, who doesn't know their limits. It's unfortunately too many of us who think somehow they're going to cure us of every foolish thing we do. Think about obesity. I heard last week the United Health Services, the biggest HMOs in the United States. He said 47% of our dollars are spent for treatment of people who have diabetes. And diabetes has as a major component, the obesity. So if we have increased obesity and universal health medical insurance, you see what's going to happen? We will, because in our communities, we have not done our job in terms of our physical well-being. We will force the price up ever more, and we'll pay for our failure as a neighborhood. So what is it that we can do that would make a healthier neighborhood? Now, there is something that a university and a community and the students can connect with.